Good day. My name is Rino Norisam, and I am the CEO and co-founder of WellNest Pod.
Together with my CFO, Weena, and CTO, Jen, we would like to bring you on a journey by taking you back to a typical Tuesday morning at one of our local polyclinics in Singapore.
If you have been recently, you know the scene. The waiting room is packed, the queue number crossed across the scene. 6 months ago, I was sitting in one of those plastic chairs with my elderly mother. We waited over an hour, and what was the culmination of that long, exhausting wait? A 5-minute session with a nurse to take her blood pressure, weigh her, and check her BMI for her routine chronic disease monitoring. As I watched the incredible nurse rushing from station to station, doing basic triage and data collection, it hits me. We are using our highly trained medical professional and our critical polyclinic infrastructure for routine administrative tasks. Every minute a nurse spends strapping a blood pressure cuff onto a stable patient is a minute taken away from an urgent case that truly needs their clinical expertise. By 2030, 1 in 4 Singaporeans will be age 65 and above. And we rely slowly on our centralized polyclinic for every routine checkup, the system will break. We cannot simply build more clinics. We have to change where and how care is delivered. This is the WellNest Pod. It is a smart, fully enclosed, wheelchair-accessible health screening cabin designed specifically to be deployed at HDB void decks. Our design idea is simple but revolutionary. Bring the triage out of the clinic and into the neighborhood. Inside the WellNest Pod, a resident can safely privately measure their blood pressure, heart rate, height, and blood glucose level. The data is instantly and securely synced to the Health Hub and their primary care physician under the Healthier SG initiative. But I know what our friends are thinking from HealthTech. Technology is great, but how do we get an 80 years old auntie to use a smart pod without getting frustrated? This is where I believe WellNest really shine and why we believe it so deeply. We recognize that the biggest barrier to elderly healthcare tech isn't data friction. We didn't just build a pod with a shiny iPad inside. We built a thoughtfully integrated AI designed for zero-resistant adoption. MOH, WellNest offer a way to massively offload routine triage from the polyclinics, freeing up your doctor and nurses to do what they do best. To HDB, this is the next evolution of neighborhood amenities. It transformed void deck into proactive mode of community wellness. To GovTech, this is how we bridge the digital divide. By using invisible AI and voice-first interface, we ensure no senior is left behind in our Smart Nation journey. Before founding WellNest, I spent over a decade in FM, facility management right here in Singapore. My job was to understand how people interact with physical spaces, optimize building operation, and seamlessly integrate services to the daily life of residents. When you look Singapore through the lens of FM, you realize our greatest asset isn't our hospital, it's the HDB void deck. It's the heart of the community, it's where our seniors already gather, socialize, and feel safe. So what if we could merge FM, community space, and healthcare? Well, my background in FM, I know how to maintain this pod, manage the power routine, operational logistics, and so to scale this, WellNest need your partnership. Together, we can rewrite the user journey of aging in Singapore.
My name is Rino, founder of WellNest, and I look forward to building a healthier Singapore with all of you.